Shall not take any time from the speaker on the list of the 10 fittest cities in the 10 unfittest cities. I will just say, as we do them later, apparently Jackson is not on the top 10. So
we were on the list yesterday.
Yeah. Well, it's hard to escape 2 days without being on the list one way or the other. Speaker of the House, Philip Gunn, good morning, sir. How are you?
Hey, Paul. Good morning. Doing well. Thank you for inviting me to be on this.
Well, I'm glad you're doing well, and we got kind of a low volume on you. If you speak up just a little bit, we can hear you and reach out and touch us. But that, when we say how you're doing, takes on a little bit new meaning since you've been confirmed with that. But tell me about it. What's the symptoms, and how has it reacted to your body?
Well, I must say that I feel very fortunate. I had very few symptoms. I had a little tickle in my throat, and that was about it. I know that some have had it a whole lot worse than me. I started with a little tickle about, I guess, probably, well, my quarantine ended yesterday, so I don't know how long ago that was. And that's really all I ever had. I never had any aches or pains or fever. I did lose my sense of taste, which, has caused me to not eat a whole lot. That's probably not a bad thing.
Yeah.
My wife was very good to take care of me. I remember she brought me a bowl of ice cream one night, and I looked at it, and I thought, I can't even taste it. Where's the joy in that? You might as well just take it back.
That's a heck of that's not the recommended diet program, though, to get COVID.
No, it's not. It's not. But that put me on one of those lists y'all were talking about there, being the not fittest cities there. But,
let me ask you this. Have you talked to any of the other your colleagues on there and how they're doing? I'm not going to mention names, but...
I have. There have been a wide variety of symptoms. Many are like me. They had maybe a little a cough, but no real fever. But then I've had some that have just really struggled with it. They have had aches and pains and fever. They have suffered for days with it. So, fortunately, that's only been about a handful of the ones that have it. But most everybody just has a little ache, little fever, and a lot of them have lost their sense of taste and smell. Mine still has not come back, but I trust that it will.
How would you direct it when we come back in October, if this thing, God forbid, is still around? How are things going to change, knowing what you know now?
Well, I think the struggle that we've all had, including the medical profession, is just exactly how do you fight it? What do you do? I know the media wants to try to connect the wearing of a mask to who got it and who didn't, and I'll just tell you, in the House of Representatives, there is no pattern that you could establish there. I know 3 of the individuals who have it were the 3 most diligent about wearing masks and trying to protect themselves, and then I've got some who didn't wear a mask at all, who have got it, and some who don't. There's just no real pattern that can be established there. I do think we have to follow doctors' recommendations. I do think the doctors are doing their best they can to figure this thing out. And I would encourage all Mississippians to wear a mask. I'm going to be very diligent to wear a mask. I was one of the ones I was probably a 50%er, let's put it that way. I probably had it on about half the time and when I should have had it, and probably half the time didn't. But I know some who weren't that diligent who avoided it. So I would encourage everyone to follow the doctor's recommendations. They're trying to do the best they can to advise us. I know the real concern is overwhelming the healthcare system right now, and sadly we're seeing the numbers remain elevated. We got increased hospitalizations. We got ICU beds being used, and that's not where we want to be. So we all need to be diligent to wash our hands, do the social distancing, wear the mask, and do what you got to do.
You didn't pass it on to anybody in the family, did you?
No, sir. I've been very blessed with that. In fact, I'm not aware that I can't identify anyone. I did my best to notify those. The problem is you don't know when you get it.
Yeah.
And you think back, well, who all have I been around in the last 4 days or whatever? And you can't identify everybody, but I did my best to notify those that I could think of, and to my knowledge, nobody got it. So that's good. My family's been very blessed to have all tested negative as well.
Well, you didn't. You were with us, Perez and I, and you didn't call us.
really?
Yeah.
Was I with you? Well, I'm
Yeah,
sorry I didn't,
you were. You were with us on that Monday, and then all of a sudden we hear that Philip Gunn has alerted everybody, and Perez and I felt like chopped liver.
That was before I got before I started showing symptoms. So y'all are good.
So we're good.
Oh, thank you, Dr. Dobbs. Thank you very much.
we feel better now.
I know I do.
Don't worry about it.
Well, I did speak with the lieutenant governor, and I think he's going to try to come on very soon, and I hope he's doing well. But I think the number now is, 41, or is it above that in the House and Senate?
I'm only aware of about 35 members. Now, we do have some staff on our end of the building, and then, of course, the Senate has had, and his office, I know, has had a few. So I would suspect the total number is probably beyond 40.
Yeah.
And I did speak with him yesterday, and he is trying to do the stay home and stay well. He doesn't feel very good, but I think he's weathering through it.
Well, that's the key to it. And I think one of the keys that we have, too, we've got to find more medicines for this, and they're trying things like the hydroxy and stuff like that. But
yes.
It's the same thing with flu. If it gets into the lungs and you don't have something that stops it and starts reversing that damage, the longer it hangs on, whether it's flu or COVID or whatever it happens to be. Certainly, if you're older and you have some underlying conditions, then it's going to get the best of you. And I think that's something that we've learned. But you're right; we're finding out more and more about this thing every single day.
Yes, sir. And I think what you said is exactly right from the way I'm being told, and so I think that's another reason everybody's got to be diligent to protect themselves.
Well, we look at the mandatory face mask for the state or not, and the governor has put out new edicts as far as some of the counties are concerned. Are you okay with that?
Well, I think the counties that he's identified are those areas where there seems to be a spike, if you will, and of course he's taken his cue from the health professionals, and I don't know that any of us are knowledgeable enough to question what they're telling us to do. I think wearing a mask is certainly something that if they advise us to do that, we need to give it a try. I know it's irritating and it's probably inconvenient, but it's better than getting the thing. And there are a lot of people out there talking about the fact that it doesn't keep you from getting it, and it may not, but it certainly cuts down on you're spreading it to others, and it's just a matter of consideration. It's certainly the minimum amount that we could do, and I think everybody just ought to be a good team player, and let's all wear the mask and do the best we can, given the advice that they're giving us.
Yesterday's report, we don't have the new report yet. It was 862 yesterday, 23 additional deaths in the state attributed to COVID.
Those numbers are very concerning, and everyone had hoped when the summertime got here and the heat arose that it would kill this thing off, and it doesn't seem to be doing that. And I think a lot of that is that people have gotten casual, and they have relaxed, and they have begun to ignore social distancing.
Well, we saw that. I want to ask you this, if you can hold on, what your thoughts are as far as school, sports, and starting. We'll have Dr. Kerry Wright on coming up 8:05, but from the Speaker of the House, his thoughts on getting school underway, maybe sports also. That with the Speaker of the House coming up next. And again, as I mentioned, Dr. Kerry Wright's at 8:05. Top fittest cities in the country: Boston, Boise, Denver, Irving, California, Washington, D.C., San Francisco, Madison, Wisconsin. Top 3, Minneapolis, Seattle. Come on. Number 1, Arlington, Virginia. Jack. Back with the Speaker of the House, live from the Trustmark Studios. A couple of things here. Are you okay with school? Because there are some parents who are a little afraid to send their kids back. There are others who say, no, we need to get them back in the schools because of the structure and everything else. Your thoughts on this?
Well, it's difficult. This is not the only difficult situation you got out there, Paul. There's always the discussion about, well, when do we reopen the economy? When do we let businesses go back? I think when this thing started, everybody was willing to play ball and give it a good faith effort. But we cannot, on the flip side of that, we just cannot quit living life. Life has to go on. People have to make a living. Children have to be educated. I think we have to find the way that we can do it in the safest most considerate manner. I think but we got to go on with it. I think we do have to get schools started back. There needs to be accommodations made for those who do have those concerns. There needs to be some distance learning. We've tried to address some of that with the legislation that we passed. But I think we're in a situation where we got to get things started back, and we got to do it in the safest way that we can.
Well, I think we were talking about. I had the sound bites from Dr. Atlas, and he made a good point. If there are some teachers who felt like they're in that vulnerable demos, then maybe they could be at home and distance learning in that manner. But most of these kids, when you start looking at it statistically, all the way through high school, but certainly in elementary school, they are neither they have neither gotten the virus, number one, or are transmitting it and are contagious. So for the most part, teachers are going to be safe from them. Now, I'm not sure about from other teachers or the administration part, but that's another story. You mentioned some of the money. Are you okay, or as far as the Speaker of the House and leader in the House, with the way that the money is being distributed out there as far as the CARES Act? Is it on schedule? Are we doing what we're supposed to be doing?
Yes, sir. We spent a lot of time working on that. I got to commend Jason White on my end of the building, who worked hard to try to put that structure together. As you know, there's a lot of different needs out there between the hospitals and the universities and the distance learning and the small businesses. And we spent a lot of time trying to parcel out what we have in a way that tries to help a little bit of everybody. The big part, I think, that we were pleased with, as we talked about, was a small business part, which we immediately passed. That was about $300.
Are you familiar with Chris Graham?
We spent a lot of this money on helping our small businesses and the unemployment.
I don't think you heard that. Can you hear me?
Yeah, can you hear me?
I was going to ask you, do you know Chris Graham, the new head of the Department of Revenue?
I do. Know him well. He's a constituent of mine. Good man.
Oh, is that right? So he is a constituent, huh?
Yes, sir.
I got to ask you about this because it's one of those subjects that I know that as Speaker of the House, some of the money or some of the bills have come through the House. Some have made it, some have not. But this last snafu we had with almost a run on liquor because of one of the announcements, there's some major problems going on as far as the distribution in this state. I'm sure you're aware of that.
Yes, sir. Commissioner Frierson has been on top of that for quite some time. He keeps me informed. He has searched for a way to try to solve that problem. In fact, I talked to him yesterday, and he said that was the one regret he had during his tenure. He wished he could have found a solution to that. That's going to be an ongoing problem. We got to continue to search for ways to solve that.
Well, it's a little bit like the post office when government gets into a situation in the private sector, and here we have a situation where that business is growing, whether you like it or not, whether you're a fan of alcoholic beverages or not, that business is growing. And in the private sector, they'd solve that immediately. They go to the bank, get some money, or they just improve it and find out a way to do that. In government, because business is growing, they don't know how to handle it. But from my understanding, is the problem we're having is they can't keep up with the demand because the distribution is antiquated at that Gluckstadt facility. We have the building there. We have the land to expand. We have the personnel. My understanding is around 80 people work there. But what they need to do is modernize. And if they did that, they could cut costs and save money in the long term. So why is that not something that we've done in taking care of this?
Well, I think you're right. And my understanding is like yours. And I think that's just one of, like I said, Commissioner Frierson has been searching for that solution. He has brought forward a number of proposals. They just haven't been fully vetted. And I think now that's something that Chris Graham is going to inherit, and we're going to have to work with him to find that solution. Is
one of it a partnership, maybe something like the lottery board, a private public operation there?
Yes, that's certainly one option. And Now there you go, mixing the liquor and lottery together. So that ought to be right up your alley, Paul.
Well,
you're always about that.
Let me throw sports betting in there. We'll do the trifecta.
Well, yeah, there you go. That's right. Solve all our problems.
All right. Well, this is going to be an ongoing topic, and I look forward to getting Chris Graham on, and we'll talk to him when he's got everything on his desk organized.
Yeah, he's a good man, and I'm glad he's in that spot.
That's what I hear. Take care of yourself. I'm glad that you are doing well, sir, and I appreciate you checking in.
Thank you, Paul. I appreciate you inviting me on today, and maybe look forward to get back in the studio in person
soon. I do hope so. It's a lot better. Thank you.
I want to say thank you for your well wishes. When I was sick, I really appreciated the text that you sent me. It was very nice of you. And tell your wife I appreciate that as well.
You got it, man. Appreciate it very much. Worry about you guys. I really do. I mean, because they're politicians, but they're good friends, and we've known them for a long time.